Welcome. Today, we're diving into the world of influenza, commonly known as the flu. This contagious respiratory illness affects millions every year, causing symptoms that range from mild to severe. Understanding what triggers the flu is crucial for prevention and staying healthy, especially during peak seasons. In this video, we'll explore the most common triggers that lead to flu outbreaks and infections. By the end, you'll have a clearer picture of how the flu spreads and what you can do to protect yourself and your loved ones. Let's get started by looking at what exactly influenza is and why it's such a concern worldwide. Influenza, or the flu, is a viral infection that primarily attacks your respiratory system, your nose, throat, and lungs. Unlike the common cold, the flu can come on suddenly and bring about high fever, body aches, fatigue, and cough. It's caused by influenza viruses, which are highly adaptable and can change from year to year. This adaptability is one reason why flu outbreaks are so common and why new vaccines are developed annually. Now that we know what influenza is, let's move on to the main triggers that make people more susceptible to catching the flu. One of the most common triggers for flu is airborne transmission. When an infected person coughs, sneezes, or even talks, tiny droplets containing the influenza virus are released into the air. If you breathe in these droplets, you can become infected. This is why the flu spreads so rapidly in crowded places like schools, offices, and public transportation. Good ventilation and personal hygiene can help reduce the risk, but airborne transmission remains a primary way the flu virus moves from person to person. Another major trigger for flu transmission is direct contact. When you shake hands with someone who has the flu or touch surfaces contaminated with the virus, you can pick up the germs. If you then touch your face, especially your mouth, nose, or eyes, the virus can enter your body. This is why frequent hand washing and avoiding touching your face are strongly recommended during flu season. Let's see how contaminated surfaces play a role in spreading the flu. Flu viruses can survive on surfaces like doorknobs, keyboards, and phones for several hours. When someone with the flu touches these objects, they leave behind infectious particles. If you touch these surfaces and then touch your face, you risk getting infected. Regularly cleaning and disinfecting commonly touched objects can help minimize this trigger. Next, let's discuss how seasonal changes can influence flu outbreaks. Flu outbreaks are more common during colder months, especially in fall and winter. The virus thrives in cool, dry air, and people tend to spend more time indoors with windows closed, increasing close contact. These conditions create the perfect environment for the flu to spread. Understanding the impact of seasonal changes can help you prepare and take preventive measures before flu season hits its peak. A weakened immune system is a significant trigger for catching the flu. Factors like chronic illness, stress, poor nutrition, or lack of sleep can lower your body's defenses. When your immune system isn't functioning at its best, you're more susceptible to infections, including influenza. Maintaining a healthy lifestyle with balanced nutrition, regular exercise, and adequate rest can help keep your immune system strong and reduce your risk. Certain age groups are more vulnerable to the flu. Young children, the elderly, and pregnant women have weaker or compromised immune systems, making them more likely to catch the flu and experience severe symptoms. Special care and preventive measures, like vaccination and good hygiene, are especially important for these groups. Next, let's look at how underlying health conditions can act as triggers. People with chronic health conditions such as asthma, diabetes, or heart disease are more likely to develop complications from the flu. These conditions can weaken the body's ability to fight off infections, making it easier for the flu virus to take hold. Managing chronic illnesses and staying up to date with vaccinations can help reduce the risk of severe flu outcomes. Being in crowded environments is a major trigger for flu transmission. Places like schools, offices, public transport, and events bring many people into close contact, making it easier for the virus to spread. Practicing good respiratory hygiene and staying home when sick can help limit outbreaks in these settings. Travel, especially by air, can accelerate the spread of the flu. Airports and airplanes bring together people from different regions, increasing the chance of encountering the virus. International travel can also introduce new flu strains to different populations. Taking precautions like wearing masks and sanitizing hands during travel can help reduce your risk. Skipping the annual flu vaccine is a common trigger for outbreaks. The flu vaccine is designed to protect against the most prevalent strains each year. Without vaccination, you're more likely to catch and spread the virus. Getting vaccinated not only protects you, but also helps safeguard vulnerable populations by reducing overall transmission. Poor hygiene habits, such as not washing hands regularly or covering your mouth when coughing, can trigger flu outbreaks. The flu virus can linger on hands and surfaces, making it easy to transfer to others. Simple actions like frequent hand washing, using tissues, and proper disposal can significantly reduce the risk of spreading the flu. Touching your face, especially your eyes, nose, or mouth, after contacting contaminated surfaces is a common way the flu virus enters your body. Many people do this unconsciously throughout the day. Being mindful of this habit and keeping hands clean can help prevent infection. Sharing personal items like towels, utensils, or cups can trigger the spread of the flu. The virus can be transferred from one person to another through these objects. It's best to avoid sharing such items, especially during flu season, to minimize the risk of infection. Spending time with someone who has the flu is a direct trigger for infection. The closer and longer the contact, the higher the risk. If someone in your household is sick, try to maintain distance, use separate items, and ensure good ventilation to reduce the chance of catching the flu. Poorly ventilated indoor spaces can trap flu viruses in the air, increasing the risk of transmission. Opening windows, using air purifiers, and ensuring good airflow can help dilute and remove airborne viruses, making indoor environments safer during flu season. Workplaces can be hotspots for flu transmission due to shared spaces, equipment, and frequent interactions. Open-plan offices, shared kitchens, and communal restrooms all contribute to the spread. Encouraging sick employees to stay home and promoting hygiene can help reduce workplace outbreaks. Schools and childcare centers are common triggers for flu outbreaks. Children are in close contact, often share items, and may not practice good hygiene. Regular cleaning, vaccination, and teaching children proper hygiene can help control the spread in these environments. Using public transportation exposes you to many people in confined spaces, making it easier for the flu to spread. Buses, trains, and subways are high-risk areas, especially during rush hours. Wearing masks and sanitizing hands after travel can help reduce your risk. Concerts, sports events, and festivals bring together large crowds, creating opportunities for the flu to spread quickly. Close proximity and shared facilities make it easy for the virus to move from person to person. Limiting attendance and practicing good hygiene at events can help reduce outbreaks. When a significant portion of the community is unvaccinated or has not been exposed to recent flu strains, immunity gaps occur. This makes it easier for the virus to spread rapidly, leading to outbreaks. Community-wide vaccination efforts are essential to close these gaps and protect everyone. New flu strains can emerge in different parts of the world and spread internationally through travel and trade. These novel strains may not be covered by existing immunity or vaccines, making outbreaks more likely. Monitoring global flu trends helps in updating vaccines and preparing for new threats. Some flu viruses originate in animals, such as birds or pigs, and can jump to humans. This zoonotic transmission can lead to new and potentially more dangerous flu strains. Close contact with animals, especially in farming or live animal markets, increases this risk. Monitoring animal health and practicing good hygiene around animals are important preventive steps. Influenza viruses mutate frequently, changing their genetic makeup. These mutations can help the virus evade the immune system, making previous immunity or vaccines less effective. This is why flu vaccines are updated every year and why new outbreaks can occur even among previously exposed populations. Overuse or misuse of antiviral medications can lead to resistance, making treatments less effective. When the flu virus becomes resistant, it can spread more easily and cause more severe outbreaks. Responsible use of medications and following medical advice are important to prevent resistance. Climate and humidity play a role in flu transmission. The virus survives longer in cold, dry air, which is why outbreaks are more common in winter. In contrast, high humidity can reduce the virus's ability to spread. Understanding local climate patterns can help in predicting and preparing for flu season. A diet lacking in essential nutrients can weaken your immune system, making you more susceptible to the flu. Vitamins and minerals like vitamin C, vitamin D, and zinc play important roles in immune defense. Eating a balanced diet with plenty of fruits, vegetables, and whole grains supports your body's ability to fight infections. Regular physical activity boosts your immune system and overall health. A sedentary lifestyle can make you more vulnerable to infections, including the flu. Incorporating exercise into your daily routine, even simple activities like walking, can help strengthen your body's defenses. Chronic stress can suppress your immune system, making it easier for the flu virus to take hold. Managing stress through relaxation techniques, mindfulness, and adequate sleep can help keep your immune system strong and reduce your risk of getting sick. Not getting enough sleep can lower your body's ability to fight off infections, including the flu. Adults should aim for 7 to 9 hours of sleep per night, while children and teens need even more. Prioritizing good sleep hygiene is a simple but effective way to support your immune system. Smoking damages the respiratory system and weakens immune defenses, making smokers more susceptible to the flu. Secondhand smoke also increases the risk for non-smokers, especially children. Quitting smoking and avoiding exposure to smoke can help protect against respiratory infections. Excessive alcohol consumption can impair your immune system and increase your risk of catching the flu. Alcohol also dehydrates the body and can disrupt sleep, further weakening your defenses. Moderation is key to maintaining a healthy immune response. Limited access to healthcare can delay diagnosis and treatment of the flu, increasing the risk of complications and spread. Regular checkups, timely vaccinations, and seeking medical advice when sick are important steps in preventing and managing flu infections. A lack of public awareness about flu prevention and symptoms can lead to higher transmission rates. Educational campaigns and clear communication about hygiene, vaccination, and early treatment are essential for controlling outbreaks and protecting communities. Delaying treatment for flu symptoms can lead to more severe illness and increase the risk of spreading the virus to others. Early intervention with antiviral medications and supportive care can help reduce complications and speed up recovery. Misconceptions, such as believing the flu is just a bad cold or that healthy people don't need vaccines, can trigger outbreaks. The flu can be serious for anyone, and vaccination is the best way to prevent it. Correcting these myths is crucial for effective prevention. The flu often spreads quickly within households, especially when one member becomes sick. Shared spaces, close contact, and common items all contribute to this. Isolating the sick person, cleaning surfaces, and practicing good hygiene can help limit household transmission. Community outbreaks can occur when the flu spreads rapidly through schools, workplaces, and public spaces. These outbreaks are often triggered by a combination of factors, including low vaccination rates, crowded environments, and poor hygiene. Coordinated public health efforts are needed to control community-wide transmission. Hospitals and clinics can be sources of flu transmission, especially among vulnerable patients. Strict infection control measures, vaccination of healthcare workers, and prompt isolation of sick patients are essential to prevent outbreaks in these settings. Workplaces without adequate sick leave policies may force employees to work while ill, increasing the risk of spreading the flu. Encouraging employees to stay home when sick and providing flexible leave options are important for preventing workplace outbreaks. Living in overcrowded housing increases close contact and makes it difficult to isolate sick individuals. This environment is a common trigger for rapid flu transmission, especially in urban areas. Improving living conditions and access to healthcare can help reduce this risk. Poor access to clean water and sanitation facilities can make it harder to maintain good hygiene, increasing the risk of flu transmission. Hand washing with soap and clean water is one of the most effective ways to prevent the spread of the flu and other infections. To sum up, the most common triggers for flu include airborne transmission, direct contact, contaminated surfaces, seasonal changes, weakened immunity, and crowded environments. Other factors like poor hygiene, lack of vaccination, and underlying health conditions also play significant roles. By understanding these triggers, you can take proactive steps to protect yourself and your community from influenza. Prevention is always better than cure. Practicing good hygiene, getting vaccinated annually, maintaining a healthy lifestyle, and staying informed are your best defenses against the flu. Remember, protecting yourself also helps protect those around you, especially the most vulnerable. Stay healthy, stay safe, and thank you for watching this comprehensive guide on flu triggers.